How did I decide which unit to do my preceptorship as a nurse practitioner student? For those who are unfamiliar, as an NP student, when the time comes to start your clinical rotations, you get to choose where you want to go. Now, I've talked about it before that this is also a weakness in our profession, that when you start NP school, they don't warn you and tell you that you're going to have to make all the arrangements for your clinical rotations. It's not like nursing school, entry-level nursing school, where you enroll in school and then you just follow the program and they send you to wherever it is you got to go. You get to decide, like, maybe a rotation or two if you want to, go into OR, if you want to go to some specialty area, the ER or ICU, but for the most part, you don't really have to do anything. The problem with the NP programs is you have to seek out preceptors and then hope that one, that preceptor is available, and two, wherever that preceptor works, there is an established relationship between their work, their employer, and your school, or that those two facilities are able to create a relationship. It's called an affiliate relationship. And it's literally just an agreement between a NP program, a university, and some facility, whether it be a hospital or a clinic, it has to do with the legal ramifications, the liabilities that go along with having a student in a facility and having a student under the supervision of an employee in that particular facility. So it has nothing to do with you as a student or them as a preceptor. It's the legal mumbo jumbo, that the hoops you got to jump through. And that's probably the most important part of the equation, is that if you don't have the legal mumbo jumbo, if you don't have that legal mumbo jumbo contract established between you, your program, and the facility where you'd like to do your rotations, all bets are off. It doesn't matter. So you're going to have to keep that in mind. I was lucky enough that I attended a school. First of all, I attend a physical brick and mortar school. I commuted 70 miles one way, and I attended classes. That particular nursing school had an affiliation with a very large hospital system that it spanned like hundreds and hundreds of miles with multiple campuses. So I don't want to say that I had my choice of venues, but I had a lot of options. Now, I was commuting 70 miles one way to this particular school. As luck would have it, I had worked in that city in the large hospital system before, so I was familiar with the system, and I was actually I had contact with the previous nurse practitioner that I worked with when I was a bedside nurse. So that was an easy decision. But I had to come to terms with the fact that I was going to be doing all of my clinical rotations 70 miles away from my house. Now, I had two options. The first option was stay close to home and do my NP clinical rotations in the local community. All of those hospital systems were very small, and there wasn't a strong presence of nurse practitioners. They were kind of here or there. And the role of the NP in those particular hospital systems, the way the NPs worked is not how I envisioned my life as a nurse practitioner. I didn't want to do what they did. First of all, they were all hospitalist NPs, and that's not what I was interested in. And the second thing was they didn't see the very sick patients. It was small community medicine, so they didn't take care of the sickest of the sick. And I had decided a long time ago that when I was going to do my rotation, that I was going to go where they could train me, where they could teach me, where I could learn and see the big, bad, ugly things that I would be dealing with as a nurse practitioner that works in the ICU, because I was an acute care nurse practitioner student with my eye on the prize of working, managing, and handling the sickest of the sick in the ICUs. So I chose to commute and go down to the ICU that I worked in as an RN. Now there was a huge time gap, so I hadn't worked down there as an RN for 6 or 7 years, and went back there and worked as an NP. Did 1 or 2 rotations there, and then I did 1 or 2 rotations in a trauma neuro ICU in a neighboring hospital. And it was kind of a meet in the middle. I couldn't find any preceptors that were within the system that I was in, but I was put in contact with this particular preceptor in a hospital campus that was 10 or 15 miles down the road. It was still 70 miles away from home, but it was 10 or 15 miles away from where I had been before. And that's how I decided where I was doing my preceptorships. I chose to do my preceptorships where I would learn the most, where it would reflect and prepare me in the best way possible to do the job that I had already been hired to do. Because as I've shared in previous videos, I had already signed a contract. I had already gotten a job working as a nurse practitioner in a larger hospital system. And even though I had a decade's worth of ICU nursing experience, I wanted to learn from the best, and I wanted to see the sickest, and I wanted to train at the highest level possible. And that's how I decided. Everybody decides differently, and you have to choose. You have to decide what you want to get out of it. I would highly encourage you to find some place that's going to challenge you, but is also a good learning environment. Just because it's where all the cool people go and where the sickest of the sick are, doesn't necessarily equate into a good learning environment. You need to be around physicians and APPs that, 1, are familiar with the role, and 2, are willing to teach you, that are going to take the time and actually teach you. Not just show up, clock in your hours and leave, and you be a scribe. To actually teach you the medicine, to actually teach you how to navigate through caring for the critically ill. And it's sometimes a crapshoot, but you have to decide what it is you want to get out of your clinical rotation. Daily Sean, I'm out.